Okay, well, I have 1:15 straight up, so we will go ahead and get going. Welcome to our biweekly update regarding the all things COVID-19 pandemic for the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll begin with some opening comments, and first, Mayor John Hamilton.
Well, I'm happy to go first, though. I thought we were going to go with the health folks first. Do you want me to go first?
We can do that,
y'all.
Happy to do that. So you want to go to Penny first?
Sounds good to me. Penny, you good for that? And then Brian, and then I'll.
That sounds like a plan. And I'm just going to start by saying go IU. So this week, our 2-metric score did fall to blue. Our cases per 100,000 were at 35 and our positivity rate just over 3%. Our CDC community level for Monroe County is now in the low category. We have seen a dramatic improvement over the past 4 to 6 weeks in the number of infections that have been reported, and that while PCR testing numbers may be down, they are still holding quite steady. So we know that testing is still occurring. We're seeing a lower number of infections, and you'll hear that hospital numbers are improving as well. The Indiana Department of Health does continue to make changes to the dashboard to share the most relevant data for the time, and the metrics map and advisory will be removed as those are no longer being used to measure the current transmission levels. The state dashboard will move to pointing people to the CDC's community levels. As you know, those community levels are based on our cases per 100,000 and what's happening in our hospitals. So we will continue to communicate and meet with our community partners to review and assess available local data as well as our trends. And in fact, the addition to the dashboard is going to include some trend indicators. So we'll be looking forward to those changes. We do continue to get questions about healthcare facilities and business requirements regarding masks, and healthcare facilities have separate requirements that do not fall under that CDC community level for their response. So masks and other precautions remain in most of all of those facilities. Any business may set requirements such as masks if they choose to do so. So I would encourage everybody to keep that mask handy in case you need it. Testing does remain available, although state-funded sites are closing. Coronavirus.gov is still the best place to find the testing options that are available to you. Our local Gravity site is open Monday through Wednesday and on Friday 8 to 4, on Thursdays 10 to 6, and it will remain open through April 1st. Test to Treat, that is a federal program. The website should be launching the middle of this month. And the idea is that locations like federally qualified health centers, pharmacy-based clinics, long-term care facilities, providers, that they will be able to accommodate and test people who may be at higher risk and eligible for antiviral treatments, so they can test them. If they test positive, they can get them that prescription right away. And every home may now order another test kit through covidtest.gov. So if you have used your 4 free tests that you've already received, you can order some more. These trends are encouraging and indicate a move out of crisis response into management and recovery. Vaccinations are still available through our public health clinic, and beginning in April, we will no longer be using the state's Zotex system for scheduling. We will just ask people to call the clinic as they would for any other vaccine and schedule their appointment. Finally, I would like to take a moment to say thank you to everybody who has taken responsibility seriously and did their part in protecting our community members. This includes the media who have shared information. It includes our businesses, our schools, and every individual who has done their part. This isn't over, but we are moving forward, and let's spring into this phase with continued care for one another. We can use more of that. Thanks. Back to you, Chuck.
Okay, Brian Shockney and IU Health.
Thank you all. Thank you all for joining us today and for your constant and supportive attendance of the past 2 years. It has been 2 years. You're being present and sharing the information through various media sources has made a difference in our community. We're grateful for that. It's nothing but good news from IU Health South Central Region. This last surge in the pandemic, while the most significant and at times seemed overwhelming, has declined quickly over the past few weeks. As it's been a long, sustainable surge, it is declining quickly. As of today, the South Central region has 2 patients in our hospitals with only COVID patient diagnosis. And those 2 are in Bloomington Hospital. In fact, over the last 7 days, IU Health Bloomington, we've only experienced 4 admissions of patients that were admitted with their primary diagnosis as COVID. And that continues to speak to where we are as a community. We are experiencing the lowest volume of COVID-19 patients in our region since the pandemic began. Even though we had some lulls between our surges in the past 2 years, this truly is the lowest we've seen it since the beginning of this pandemic. For the first time, our team was truly faced with a sense of calm this past week after these 2 years of pandemic. On the screen, you'll see a picture that our clinical manager of critical care at IU Health Bloomington, our new hospital, shared this week. Missing from the picture is the additional equipment, the supplies, the PPE, all those things that were critical to take care of these COVID patients and that have lined our hallways through this pandemic. This is the first time since we moved into the new hospital on December 5th that the halls, while still full of patients that you're looking at, are peaceful, and they were intended to be in the design of the hospital. This picture is surreal, but has truly brought a sense of comfort to me, and as I know our clinical staff also have felt a sense of comfort, regaining and again returning our focus to the excellent care they provide day in and day out to those that need it without the burden of COVID weighing heavy on their minds and their hearts. Paul Solars stated, "Collaboration allows us to know more than we were capable of knowing by ourselves." I'll say that again. Collaboration allows us to know more than we are capable of knowing by ourselves. This has been the case with this group that assembled 2 years ago and has continued to connect every week thereafter, in addition to you, the press, in these press conferences. The City of Bloomington, Indiana University, Monroe County Health Department, Monroe County Commissioners, IU Health, so many other organizations have dedicated the past 2 years to the fight against COVID-19. As Penny said, this isn't over, but it's looking very good because of our efforts. While we faced challenges throughout, the continued alignment and commitment of this team made a difference. Mask mandates, vaccine clinics, testing accessibility, most importantly, transparent communications each Friday that made a difference. So when we look at the COVID data on the Indiana State Department of website, we see that Monroe County has had 271 of the over 22,200 COVID deaths since the beginning of the pandemic. That's just 1.2% of COVID deaths in Indiana. We've also had 27,472 of the 1.6, almost 1.7 million COVID-19 cases recorded for the state. And that's 1.6% of Indiana's cases. And yet our county is the major medical hub for 11 counties and tens of thousands of students that flock to Bloomington every year from across the globe. I won't say we weren't hit. We were hit hard by COVID, but I can safely say that the efforts of the individuals on this call and the organizations they represent throughout this county have made a difference and saved lives. This collaboration and action for the health of our community will stand as one of our proudest moments at IU Health. It's not one event that stands out or makes a difference. It has been the continuous and relentless focus on responding to a new and never before experienced situation of our generation. So again, thank you to our community, businesses, community organizations, the media, and most importantly to the partners that have been here every day and every week for 2 years for the good of our community and for the good of each other. So let's pray that these efforts will never have to be repeated due to the great science and learning that resulted in vaccines, hygiene practices, and everyday life changes that represent the best of these past 2 years. I'll take questions at the end.
Chuck, you're muted, but I You want me to
Check,
jump
maybe
in?
he's frozen.
Oh, maybe he's frozen. Well, that's not, I don't know if that's ever happened. Chuck?
Now I'm back.
Shall I jump in?
Yeah, go ahead.
Thanks so much. I'll just do my quick report of one employee case this week and non-detect levels in the wastewater. And based on what you've heard from the health folks, we wanted to go first with, we did want to indicate we are likely planning to stop these regular public press conferences and unless they're needed. And I do, like my colleagues, want to take a moment. This has indeed been an historic challenge, not seen in a century. I'll just echo the way our community came together early and functioned so well as a team throughout this 2 years. I add my thanks to the collaboration of this team that you've seen so often. We here in this group all had to make decisions individually and together, decisions that were sometimes difficult, sometimes uncomfortable, sometimes unpopular. But I believe we always did our best to stick with the science. As has been said, I do believe as a result of this, our community was safer, was stronger, indeed, as indicated, fared better than many parts of the state. We also, as mentioned, know there were very real losses felt by many families through this pandemic. 271 deaths locally, the pandemic and the terrible recession that hit too. Those losses are still felt in many circles, even today. And I also want to just add that in our collaboration together, I do believe we have saved lives and thank all of you, all of us for that. We, as a community, we found innovative ways to keep going. We pivoted quickly in many ways to protect our community, including with new programs of financial assistance and direct actions for employers, for social service providers, for individuals and families and local governments. Our community through this showed itself as strong and compassionate. So I'm going to just close my remarks as well with some thank yous to many of you who directly save lives in our community. And first, thanks to our public health system. Penny Caudle, you and your colleagues for extraordinary 2 years. I guess you signed up for it, but you didn't expect it directly. But just incredible thanks for the public health system and the way you have raised your game and done so much. I also will thank our direct hospital and healthcare system. Brian, you have stood for IU Health and of course the whole health system really through this, and want to thank you for and your colleagues in that system for also an extraordinary 2 years of sacrifice and giving intensely. Thanks to our first responders and so many essential workers throughout our city. We've, the people who got us groceries and delivered packages and taught our children and of course, including our government workers themselves, both in the city and the county, and thanks to the county commissioners and all our collaboration at the local government level. I want to thank our local institutions who led the way in many ways, including, of course, Indiana University and more institutions, our school systems. So many have stepped up to do extraordinary things. I do want to explicitly thank our governor, who had a difficult job to do during this. And I want to note, we may not have always agreed with everything, but I know it's important, and thank him for giving us space locally to do what we could do. Thank our communicators, media, all of you who share and inform. Knowledge is power. It's also safety. It has been during this pandemic, and you all helped us make better decisions as for ourselves, our families, the media here directly, and Chuck Carney, your great role, Andrew Krebs, who's been in the background of every meeting as well. Thank you. And I'll just close finally by thanking everybody in the community who performed the acts of kindness that have been so important over the past 2 years, small and large, bringing groceries to a neighbor, making and sharing masks, playing music to a friend or neighbor for culture-starved people, and just sharing the kind words and actions in hard times that have made such a difference. I feel very fortunate to serve as mayor of a resilient city like this, full of such caring people. And I'll be happy to take questions at the end. Thanks, Chuck.
All right. Thank you, Mayor Hamilton. Let's go to the Monroe County Commissioners. Penny Givens reporting today.
Thank you, Chuck. I wanted to let folks know that we have been able to use some of the federal money that's come down to us to distribute over $500,000 to the Monroe County employees and incentives for getting those vaccines. That means well over 500 of our employees have opted to do that, and we're very, very proud of them and very thankful. I also want to remind people that there still is money available through the township trustees for those who are having challenges with their rent, with their utilities. But I also think that people need to keep in mind that as we've worked so hard throughout this pandemic, where we've taken grief about our masks, about our size limits, and kind of led the way around the state, which has happened. There still are things that we get to do as we emerge here because of the federal money that's come through, that we can help to make not only our health better, but our economic situation much better throughout this community. And we're going to want input from people as we move forward. I want to thank also Penny Cottle and the amazing leadership she has shown throughout this pandemic. But it's also been true of everybody who's been on this call. And I'm going to miss seeing people on a regular basis. There's been such an incredible collaboration, as Brian has said. And we don't know how many lives we've saved, how many people we've kept out of the hospital. But I certainly think that both the collaboration and the efforts of people in this community have made a huge, huge difference. So I also want to thank everyone, including all the residents who stepped up. Thank you.
All right. Thank you, Penny. Let's go to Indiana University, Aaron Carroll and Kirk White.
I will keep my remarks short because I'm sure that Kirk will be more likely to do a lot of the roundup and thank yous, but we've been heartened at how much the numbers have come down. We're seeing very few cases on campus at this point, and our positivity rate is about as low as we've seen this entire academic year. This is going back into the summer. So we're grateful that everything has worked out reasonably well in the last few weeks and that it continues to do so as masks have become optional. We look forward to hopefully this continuing for weeks more and being able to remove some other layers of protection, but we will keep an eye on how things are going. I'm always hesitant to do the victory lap, just making sure that new variants don't start to rise somewhere else and cause us issues. But like everyone else, we are incredibly grateful to all the people that have contributed over the last few years to helping us weather this as best we can.
Well, thank you, Dr. Carroll. And boy, we sure owe a debt of gratitude to you as well, being our Chief Health Officer. You've added an enormous amount of expertise to these weekly calls and your weekly Zoom teleconferences where you've answered probably thousands of questions over the last year that's really helped the entire state understand the pandemic from a pediatrician's point of view. And I always like to trust a pediatrician. I think if you can work with kids and you have that kind of heart, you're able to give the right kinds of guidance. And so you've been a gift to us as well. And we want to thank you. And as you mentioned, Dr. Carroll, our numbers at IU Bloomington have continued to stay steadily low. This past week, our total count was just 20 cases, 14 of those students and 6 were faculty and staff. And that's the lowest we've seen this entire academic year. So we've continued to make great progress. And though we're talking about the end to our weekly news conferences, we ended our mask requirement and it's now mask optional on the campus as of a week ago. I'll just remind everybody that, as Dr. Carroll mentioned, we do need to stay vigilant, and our in our case, at least for the time being, we're going to continue our mitigation, asymptomatic and symptomatic testing. Those systems are all in place and will continue for the time being. And we have our quarantine and isolation facility still ready to roll. There's no one in it right now, which is a good thing. We like those kind of reports, and we'll continue contact tracing. And our campus team, the coronavirus response unit, will continue to monitor things on a regular basis, and as we have for the past almost 2 years now. And yes, a big thanks to, from the university's perspective, you can't do the kinds of things we were able to do to help the university community, which translates really to the entire community, without some great leadership. And so I want to thank President Michael McRobbie, President Pam Whitten, Provost Lauren Rebel, Interim Provost John Applegate, and Provost Rahul Shrivastava, our leaders through this past 2-year period, who really set the tone for the right kind of crisis management and recovery. Other universities and communities suffered when they didn't have the kind of forward-thinking leadership, and so we owe a debt of gratitude to them. And finally, of course, our students, faculty, and staff that answered the call. You know, when Provost Rebel asked me to start helping with this in May of 2020, we had a long list of things we had to do before we could reopen the campus, and I didn't know if we could do it. But what I learned was, when you get everybody together, we'll overcome. And we repurposed people, folks that started to do things they had never done before on our staff. Our students had to adapt. We were without commencements. We were without lots of milestones. There's been a lot of things that we've had to adjust, but we're back on a good footing. And so the challenge we have now is to take the lessons learned of the last 2 years, the things that we fought our way through week to week, day to day, and even hour to hour. We had to come up with new solutions in responding to this. We've got to get all that captured, and we've got to get it in our emergency preparedness plans so that we don't have to reinvent this when it comes back again, whether it's a pandemic or whether it's the tornado through town or the flood or whatever it is. The kind of collaboration that we've had over these past couple of years among everybody on this call and others is a great lesson learned about how well local government and a local community can come together and rise to the occasion in responding to an emergency. So that's our challenge. Let's capture this. Let's take these leadership lessons learned and not forget the great things we were able to do, so that it comes a little easier the next time. You just have to use your imagination. These kinds of things do happen to communities, and we'll be ready for the next one. So with that, I say thanks again.
Okay, and we will go into questions. First one from Dave Askins, this one to Mayor Hamilton. As of a couple of days ago, there was still a protocol at City Hall where the public had to sign in at the front desk and could not go farther into the building. Appropriate city staff would come down to the lobby and meet in person. There was also a big sign in the hallway that said employees only beyond this point. Not sure if that description is up to date. The question is, will the public again have unfettered access to City Hall? And is there some metric that needs to be hit before that will happen?
Thank you so much, Mr. Dave Askins, for a question. We appreciate that, and all of you for your attention to that. And before I answer that, let me just say I agree with Dr. Carroll. It's not a victory lap here. What we're doing, we are just noting a very important mark, I suppose, as we go. And thanks for that, and also the comments about how much we learned. We can take those lessons and move them forward. Absolutely. So, and I just quote Penny Caudill again when she said, "It's going to be complicated getting out of this, like it was getting in." And our continuity of city government team, which is in charge of recommending how we in City Hall manage, is meeting as they have been. We are adjusting protocols. The mask mandate, of course, is off in City Hall. We are opening up. City Hall is now open for meeting rooms, like in the council chambers and other meeting rooms with appropriate distancing still to try to keep people careful. We know there are still the virus is here, and some people are not vaccinated and boosted, and others are of concerns. So we're still being careful. But yes, we will expect City Hall to open fully again. It is not quite yet. We're still bringing city staff down to the atrium to meet with individuals who come in. I do expect that to change in the weeks ahead, I expect, but we will be watching that, and I'll wait for the science-based continuity of city government to advise me when we ought to do that exactly. Thanks.
Okay, a question from Holden Absher from WFIU WTIU for Aaron or Kirk. How do you anticipate spring break will influence COVID transmission in the IU community?
Well, traditionally, when we have breaks like this, what we do is we see a bump when everyone returns, whether that's due to changes in behavior or because our constituents have learned that when they return, it's a good idea to test. We do pick up more cases in that week, but it's not a surge in the sense that it's exponential growth that continues for some time. It's usually a bump, and then everything usually returns to normal. It's also important to recognize that lots of other places in the United States and elsewhere are very safe right now as well. And going there for outside activities isn't inherently dangerous, as much as it would be staying at home when it's snowing and having lots of indoor activities here. So we're watching, and we'll certainly keep an eye on it. And we expect, as we've seen before, a bump, but I don't expect it to be big changes or anything that we're too concerned about.
Okay, hanging on here for another question or two, if you've got one. And again, we do plan for this to be our last one unless the bat signal is put up and we need to be called together again. Let's hope that is not the case, but we are prepared and have proof of concept if we do need to. And we do appreciate, again, the media who have consistently shown up for this, because without that, getting the word out is really irrelevant. We need your help in getting this done. So we do appreciate your coming every week and reporting on this. And that's what this was designed to do. And we appreciate the attendance and all the questions. So as we are wrapping up here, don't see another question, and there's 15.3 seconds left with IU and a 1-point lead over Illinois. So I'll give you that moment to take a look and see how this game ends. But again, thanks to everybody here, and thanks for your attendance, and appreciate your time.
Thank you.
Thank you all so much. Thank you, Chuck. Thank you, everybody. Be well.
Weekend.